Welcome to Simple Psych with Macy, the #1 podcast for everything psychological. In today's episode, What Are We Made Of?, we're going to discuss a pretty heavy topic, medical assistance in dying, or MAiD, and how it is relevant in the world of clinical psychology. Even if you're not a physician or a psychologist, chances are you've heard of MAiD. It's been in the news recently because the Canadian government is trying to expand its eligibility criteria. In exactly 1 year from the day that I'm sitting down to record this podcast, Canadians with psychiatric disorders will be legally allowed to have a medical professional help them die. The decision to include mental illness in the list of acceptable conditions for MAiD has been incredibly controversial. But before we can understand the controversies surrounding MAiD, we need to know what it is and how it works. So, in today's episode, I'll explain the current legislation surrounding MAiD right here in Canada. Then, I'll launch into a discussion of the pros and cons of MAiD for mental illness. Spoiler alert, supporters of MAiD argue that we have a duty to help people alleviate their pain and suffering, while critics worry that it opens the door to a host of ethical concerns. MAiD is a deeply personal and complex issue, so I'm going to try my best to tread carefully throughout my podcast. To any listeners who have personal experience with medical assistance in dying or suicide, please take care of yourself and reach out for help if any of the topics I cover cause you any distress. But without further ado, let's get started with a little discussion of the history of medical assistance in dying. Several landmark cases have put the topics of euthanasia, assisted suicide, and the right to die into people's minds. These topics even made it into pop culture in the 2004 movie $1 Million Baby, which I watched to procrastinate writing the script for this podcast episode. It's about a boxer who's injured in a fight and ends up with quadriplegia, and here's a second spoiler alert, she asks her trainer to help her die, and he eventually agrees to euthanize her. I found the movie quite entertaining and just applicable enough to the topic of MAiD that I didn't feel terrible about myself for watching it instead of sitting down to write my podcast. Anyways, I digress. The short of it is that social norms around death and dying are shifting, and simultaneously, access to MAiD has been steadily increasing across the globe. Here in Canada, we have some of the most permissive criteria for MAiD in the world. Recently, there's even been talk of expanding the criteria to include mental illness as the sole underlying condition required for MAiD, and that's where we reach the topic of my podcast. Right now, MAiD's only available in Canada for people who have a physical health disorder. In 2021, we scrapped the reasonable foreseeability of death criterion, which means that your condition doesn't need to be terminal to get MAiD, it just needs to be grievous and irremediable. I won't waste valuable podcast time covering the extensive list of other criteria you need to meet, but I'd encourage listeners to look at the Department of Justice Canada website, which outlines who is currently eligible for MAiD. MAiD was supposed to be expanded to mental illness in March of 2023, which is right now. However, MAiD is obviously a sensitive and complex issue, so the Liberal government has opted to postpone the expansion until March 2024. The delay has been met with some seriously mixed responses. Compelling arguments have been presented both for and against MAiD for mental illness. Hold tight, because that's what we're going to talk about next. Let's start with the pros of MAiD for mental illness. Throughout my research, the #1 argument I've seen for expanding MAiD to people with a mental illness is that it will alleviate their pain and suffering. And it's hard to disagree with this, because isn't that our main goal as clinical psychologists? This is especially applicable to people who have a treatment-resistant mental illness, those who have tried several types and combinations of psychotherapy and medication and continue to be in immense distress. I came across a really powerful blog post by a man named Cody from Alberta. Cody's in his late 30s, and he's been living with treatment-resistant depression and anxiety since he was in his early teens. Here's one passage that really stuck with me. There comes a time when the fight has gone on to the point of total exhaustion, and after the 20-plus years of battle, it should be my own moral and ethical choice to escape my unbearable suffering through medical assistance in dying. I'm starting to wonder if it's fair for psychologists and medical professionals to force people to continue living when all they want to do is end their pain. Of course, we have a duty to get people access to the best evidence-based forms of treatment, but at a certain point, might we be denying the person's autonomy by keeping them alive? And that brings me to my next point, which is that MAiD could be a way to respect people's personal autonomy. I agree that we all have the right to die with dignity. And this is some pretty heavy stuff, but if I was waking up every day and just suffering and there was no end in sight, I would obviously want to have some control over how I go. I'd urge any listeners who vehemently oppose MAiD for mental illness to go browse the Dying with Dignity website. That's what I did, and reading all the stories about folks like Cody with treatment-resistant mental illnesses and their fight for medical assistance in dying was really inspiring, and it's led me to soften my stance a little bit. I can study depression out of a textbook until the cows come home, but I still have no real understanding of what it is like to be depressed, to have little hope for the future, and to expect nothing but more suffering. At the end of the day, maybe it's not our place as psychologists to determine how someone should live or die, and I'd agree with the argument that people with a mental illness should be granted autonomy. If it's done right, expanding MAiD to psychiatric disorders might be a way to respect that autonomy. In the same vein, you could argue that legalizing MAiD for mental illness is a step towards destigmatizing it, because it recognizes that mental health is health. Dr. Justine Dembo, a psychiatry prof at U of T, made that exact same argument. She said that if those with mental illness were excluded from MAiD, it would further perpetuate stigma, implying that the suffering from mental illness is not as severe. If mental health is health and people with physical disorders are granted medical assistance in dying, then perhaps it is discriminatory to not grant the same opportunity to people with a mental illness. Finally, I think it's important to acknowledge that if someone is really committed to ending their life, they're probably going to do it regardless of if they have access to MAiD. We had a long talk in my Foundations of Clinical Psychology course about the tragic fact that not all suicides are preventable. Furthermore, having a loved one or even someone in the larger community die by suicide is extremely distressing. I think that expanding MAiD to mental illness could make death by suicide a less traumatic process for the individual's loved ones. Maybe MAiD could involve special counseling and bereavement groups being set up for the person's family and friends. And in this sense, MAiD could be a way to regulate deaths by suicide that would have likely happened anyways, so that we can mitigate harm to the person's greater community. When I first heard that MAiD was going to be expanded to include people with mental health disorders, I was shocked and I was upset. After reading some arguments by MAiD supporters, however, I can almost wrap my head around it. Let's say, for example, that you're 50 or 60 years old, and you've tried every kind of treatment imaginable for your depression, and you're still in immense distress. And maybe you feel like you simply can't go on, and you're planning on ending your life regardless of the laws that are in place. But you don't want your death to traumatize your spouse and your children. In that case, having all of the MAiD stuff in place could actually make the process go a little smoother. We definitely need to approach the topic of MAiD for mental illness with nuance, and I hope that all of you listeners keep that in mind as I move into the final section of this episode, a discussion of the cons of MAiD. Here's the first con that comes to mind. How can we distinguish between a person who is suicidal and a person who is rationally requesting MAiD due to their mental illness? The very nature of mental disorders makes things complicated. For example, depression affects the way that people see the world. There's a lot of hopelessness and despair, like things are always going to be this way and I'm never going to get better. I don't want to underestimate the capacity of people with mental illnesses to make choices for themselves, and I think that goes without saying. Nonetheless, mental disorders are fundamentally different from physical disorders because they literally affect the part of your body that makes decisions. Second, and this is one of the most significant cons I've come across about MAiD for mental illness, how are we supposed to determine irremediability? It's not like with physical disorders like cancer, where healthcare practitioners can run a series of tests and pretty clearly define the prognosis. Even certain diseases that are related to the brain have clearer prognoses than psychiatric disorders. I'm thinking about Alzheimer's and Parkinson's, which are currently covered in the existing MAiD laws. Things like depression and anxiety are much more complicated, and it would just be really, really tragic if someone utilized their rights to MAiD when they actually could have gotten better. We haven't done sufficient research into the prognosis of any mental disorder, and therefore we don't have sufficient data to conclude that these disorders are irremediable. Dr. Gained, a psychiatry professor from U of T, would agree with this. In his opinion, we still don't have any reasonable or evidence-based way to predict the irremediability of mental illnesses. And if we don't have clear-cut irremediability, how can a physician's decision to offer MAiD ever be completely objective? Without scientific evidence that someone won't get better, any MAiD assessment will ultimately come down to subjective decision-making. And personally, I think that's both anti-scientific and unconscionable. The stakes are just way too high for this to be a judgment call, and I think that lots of psychologists and psychiatrists would agree with me. I know that many of them feel like their fields didn't get properly consulted by the government and that the MAiD expansion is racing ahead far too quickly. Next, I worry that the time and money we're putting towards MAiD should be put into treating mental illnesses instead. If we can't establish irremediability, then the potential will always exist that with more aggressive, intensive, or individualized treatment, we could actually alleviate the patient's suffering. Also, I know that we're on the cusp of some breakthroughs when it comes to interventions for treatment-resistant mental disorders. For depression, it's not just talk therapy and SSRIs anymore. Experimental drugs like esketamine have shown a lot of promise, and we're getting better at using procedures like transcranial magnetic stimulation to treat depression. I think that our number one priority should always be finding an effective treatment for the individual, and that MAiD should be seen as an absolute final resort. Additionally, I worry that MAiD could get misused. The Canadian Association for Suicide Prevention released a statement about MAiD. Just as life is getting harder, it's getting easier to kill yourself. It's blunt, but it's true. We're currently in the throes of an opioid crisis, a climate crisis, a recession, and just a time of all-around social instability. External life factors often fuel much of the suffering that people with a mental illness face, especially for vulnerable or marginalized populations. I'd be willing to bet that MAiD will likely be a less expensive process than continuing to live, so I could see people of low socioeconomic status, for instance, people who are homeless, seeking out MAiD rather than treatment. Dr. Gained from U of T even went as far as to say that MAiD expansion represents a colonial legacy of policies that favor the autonomy of the privileged at the expense of the marginalized. Could MAiD be wielded as a quick fix for social issues like homelessness and addiction? To make sure that this doesn't happen, MAiD must be strictly, rigorously, and perfectly regulated before we start to grant it to people with a sole mental illness. Finally, I'm worried about the age minimum for accessing MAiD. On the Department of Justice website, it says that Canadians only need to be 18 years old to request MAiD for a physical health condition. I wonder if this will change for mental health disorders because 18 seems way too young. I highly doubt that someone as young as 18 has exhausted every other form of psychological intervention. Plus, as a young person myself, I know that everything that happens right now at this age just feels like the end of the world. I think that we need to adopt a developmental psychology perspective here. Perhaps MAiD for mental health should only be available once the individual's prefrontal cortex has matured. I'd feel a bit better endorsing it if you had to be 25 or older to request MAiD. I clearly have a lot to say about this topic, but sadly I'm running out of time for this episode, so I'm going to have to start wrapping things up. I've decided to call the last section of my podcast Yes, But, because basically I'm at a bit of a standstill. Supporters of MAiD for mental illness have raised excellent points. It could help us alleviate suffering, grant autonomy to people with mental health disorders, destigmatize mental illness, and minimize the harm that suicide causes to people in the community. Still, MAiD for mental illness clearly has the potential to be dangerous. How will we determine whether someone is rationally requesting MAiD or just expressing suicidality as a symptom of their disorder? Plus, there's the issue of irremediability, the fact that treatment should be the number one option, and the concern that MAiD could be misapplied to marginalized groups and young people. So, what are we as Canadians made of? Should we support medical assistance in dying for those with a mental illness? I'm inclined to say that yes, we should proceed with MAiD for mental illness, but there needs to be significantly more research into how we can determine irremediability first. Yes, we have a duty to help people alleviate their suffering in a way that minimizes harm to their loved ones, but MAiD must be incredibly well regulated to ensure that it is done right. I think that the only way to proceed is with immense caution. Although the government came under some fire for postponing the MAiD extension, I think that was absolutely the move. If, and only if, we can create an extensive body of research, rigorously regulate MAiD, and prioritize treatment over everything else, then I think I can wrap my head around including mental illnesses in the criteria for MAiD. Time's up, but before I go, I'd like to thank you for listening to my podcast. I'll definitely be keeping my finger on the pulse and following MAiD in the news over the next couple of years, and I hope that you do too. Once again, I'm your host Macy, and you've been listening to Simple Psych. Bye-bye.